The cost of managing the coronavirus has forced many who have tested positive to dig deep into their pockets in order to seek medical assistance at a time when there is still no known cure for the virus. Already the financial burden of managing the virus is quite heavy, as one will need a non-reusable face mask which retails at between 50 to 100 shillings per piece, depending on the type of mask one is wearing. WHO recommends the use of a surgical face mask or a KN95 which retails at between 500 to 1000 per piece, while the surgical face mask goes for between 50 to 100 per piece. However, the common mwananchi is not able to use and dispose this mask at single use, considering the frequency and the cost of changing the masks. While regular hand washing or sanitizing is being encouraged, the use of an alcohol-based hand sanitizer with at least 60% alcohol content will cost one between 100 shillings to 200 shillings for a 50 milliliter or a 65 milliliter bottle. According to Dr. Njihia Kihara, a medical officer, the financial implications of managing the virus if one tests positive, has an underlying condition, and is symptomatic is quite high, as there are many things that are involved in providing support and relief to a patient.
When you come out to the hospital, there are those who are just put into isolation. You understand? They're just in an isolation room there. So there is nursing fee, there's a doctor's fee, there's a bed charges, okay? There's now the medication that they'll be given, they'll be put on. And then basically that. So that one will come, if there is no much interaction, not short of 15 to 20. That is per day.
In the past 24 hours, the Ministry of Health reported 871 patients were admitted in health facilities nationwide, and 6,284 are on home-based isolation and care. The financial implication of home-based care compared to being in a health facility is also much cheaper.
When you factor in all that, because now the concept of PPEs is not there in your home-based care, because not everyone is trained how to do that. The only thing we need is to put on your mask, wash your hands, sanitize well, okay, and distance from that patient who is unwell until when they are ready to go for the next test after the 10 to 14 days. You understand? So there's a cost of the new caretaker, the person who's coming in. There's a cost of your, does not become a special diet. Saida food yako si food unakula the normal way you normally eat. No, it's a prescribed, it's a prescription. Your food now becomes your prescription. You're consulting your doctor, of course. You're consulting your nutritionist, of course. Someone who's taking you through we have concerns here and there. You're basically consulting. That's why it comes to around 2,000 shillings, because there's a caretaker, there's a food, and there's a medication. Okay? Then it all depends on what kind of regimen we put you on. Depending on, it's usually customized based on the patient's needs.
Even though face masks combined with other preventive measures such as frequent hand washing and social distancing help slow the spread of the coronavirus, the risk and likelihood of getting a surge is looming come January 2021, at a time when the world is ushering in the festive season and Christmas traditions are likely to be upheld. Rachel Anyango, Look Up TV.